As patients, carers, members of the Philippine Alliance of Patient Organizations, we breathe disease and death every day.
It is a struggle on all fronts, physically, mentally, emotionally, spiritually, and financially.
It has its disappointments, but also high points, as we encountered kind, healing souls along the way. But just when we thought we had it tough, COVID-19 made our fears bigger and deeper.
We cannot afford another disease, nor can we afford to put up a fight on all fronts. This is not our fear alone. Never in the history of mankind that there has been a disease that destroyed and disrupted so many lives and hope all over the world.
The COVID-19 vaccine is offering us hope. It is not perfect, but at this moment, it is our best chance to stop living in fear and to start living in hope.
This will not work if only a few of us chose to be vaccinated. All of us need to get the vaccine because no one is safe until everyone is safe.
PAPO stands solidly with experts and advocates for COVID-19 vaccine. We invite you to join this call of unity as we launch Bakuna Now Na to address the infodemic and help increase vaccine acceptance.
Never in our history has there been a more urgent call to stand united. Get vaccinated. So together, we can overcome COVID-19.
Bakuna, now na! Bakuna, now na!
Bakuna, now na!
Bakuna! Now na!
Bakuna! Now na!
Bakuna! Now na!
Bakuna Now Na!
Bakuna! Now na!
Bakuna, now na!
Pagplano ng pamilya, hawak ko sa iyong kamay. Kaya pumili na. Hindi na ako matatakot, dahil handa na ako. Hindi na ako kabado, anuman ang marating, sa tulong ng family planning. Alam kong kaya ko,
walang takot at kaba. Pag may plano, protektado.
Patuloy pa rin ang laban natin sa COVID-19. And together, we can beat the solusyon.
B. Bawal walang mask.
I. Isanitize sa mga kamay. Iwas hawak sa mga bagay.
D. Kumistansya ng 1 metro.
A. Alamin ang totoong impormasyon tungkol sa COVID-19.
Protektahan natin ang sarili at mga mahal sa buhay.
BIDA. Be the solusyon sa COVID-19.
Hello and good evening, everyone, and welcome to another episode of Alaga Health Checkup. And ngayong Saturday evening na ito, we are celebrating, almost end of the month na, Breast Cancer Awareness Month. Yan, we're celebrating that for the entire month of October, and of course, Pink Power ang chinik-champion natin to celebrate this advocacy. And of course, we would like to thank our partners for the show. Of course, we have Quarantalk Media. We also have our friends from Hello Doctor. And of course, 2030 Youth Force, our Philippine Alliance of Patient Organizations, Experto, PlayLabs, and several others who are making this program, free consultation, and of course, advocacy program possible. So, with that being said, na-excited ako sa topic natin ngayong gabi because we will be talking about breast cancer awareness, breast cancer prevention. Ano nga ba yung mga dapat nating alamin tungkol sa advocacy na ito? And of course, hindi po makukumpleto ang ating program nang hindi natin nakakasama ang ating mga co-hosts this evening. And of course, that would be the one, the only, the beautiful Doc Jucille Roderos. Good evening, Doc Villa. Welcome back to the program. Looks like she's having a little bit of difficulty coming into the program, probably some technical difficulties, but don't fret because tonight we are being joined by one of the most in-demand OB-GYN consultants that we have. And of course, she's back coming from a very highly rated Popcom episode from before, none other than our obstetrics and gynecology consultant here in Alaga Health, none other than the amazing Doc Florentina Villanueva. Welcome back to the program, Doc.
Thank you, Dex. Sobrang extravagant naman yata yung introduction na yun. Good evening, everyone. Good evening to our listeners tonight. I'm happy to be here.
Yes, thank you for joining us, Doc. We're very excited kasi sobrang lapit po sa puso ng ating viewers ang usapan tungkol sa cancer prevention. Lalong-lalo na we're celebrating Breast Cancer Awareness Month. And of course, a lot of talk about reproductive health, sexual health, at ano nga ba yung mga myths or kaya mga misconceptions about this, Kasi daming nababasa po online about possible concerns and issues na nakakapagpakaba sa kanila. So, with that being said, perhaps we can start the program by learning more about why talking about breast cancer awareness is very important. Maybe we can do that through Startup. Yeah, so good evening everyone, and let's ask Doc Titit exactly, Doc, ano nga po ba yung reason why we are asking everyone to talk more about breast cancer awareness? What is it about the advocacy that makes it very important for us to talk about it during the month of October?
Breast cancer is one of the leading causes of cancer deaths in women. And this is a cancer which can be detected using your fingers. That's why we really teach women how to do self-breast examination. Kasi the earlier it is detected, the earlier the cure, then there's a possibility of that it's going to be a cure actually na pwede po yun. So one, we really want everybody to be aware that there is a risk for cancer. Number two, that you can do something about it early on. So siguro Dex, yun na lang muna. Yun ang aking introduction, and then we can answer the questions later.
Yes, perfect. Thank you for that, Doc. No? Kasi ang magandang ma-highlight dito sa ating mga viewers is that you can actually spot the issues related to breast cancer very early on. Kailangan lang, of course, ng tamang technique and of course, proper monitoring. No? Kailan ba siya dapat gagawin? Pwede ba siyang gawin any time of the month o kaya may buwan ng dalaw, etc. So maybe we can jump into the questions already. And if Doc Via is already able to join us, hopefully we'll have an even more or even richer discussion. Oh, it looks like she's here. Good evening, Doc Via. Welcome back to the program.
Good evening po sa lahat ng ating mga viewers, and of course to Doc Titit. No, I'm so happy to be joining you again, Doc, in this very much awaited session with Doc Titit. Si Doc Titit po is one of the most in-demand doctors, consultants natin sa show. So we're very happy, we're very honored to have her again. No? And of course, she's one of my mentors, one of the best mentors that we've had in med school. No? So marami na naman po tayong matututunan tonight, and hopefully, marami na naman pong mga impormasyon yung ibabahagi natin sa ating mga viewers na patuloy pong sumusubaybay po. Ang dami na, Doc Dex, na yung mga viewers natin na they have been following Alaga Health for over a couple of months now since we started. And they have been actually very close to us because they have time and time again supported Alaga Health. So maraming salamat po, and sana po patuloy po nating suportahan ng Alaga Health, and of course, patuloy rin po naming pag-iigihan ng aming serbisyo, ang aming show, so that we can help a lot of people also through this advocacy. So Doc Titi, thank you so much. Doc, you look so good.
Good to be back.
Great. Actually, ang maganda dito is that it looks like tuwing pag-uusapan natin ang reproductive healthcare, ang women concerns when it comes to their health, sobrang daming viewers ng Alaga Health. So hopefully that's going to be translated into this program, this particular episode as well. So I think it's time for us to jump into the questions already. So first up, we have here from Ma'am Desiree Gonzalez. So, ang sabi niya dito, nagka-breast cancer po yung dalawa kong tita sa father side at yung isa ko pong tita sa mother side. Yung mama ko naman po nagka-myoma. Mataas po ba yung chance na magka-breast cancer ako? Nako, I already have an answer in my mind, pero let's get the answer straight from our consultant. No? Mukhang medyo may risk factors na nakita tayo dito. So, let's give it to Doc Titit. Yes, Doc. Any response po?
Ang family history is very high kung first degree relative. That means nanay, kapatid is already second degree. So what is important is you follow the history of the family. So yes, in your case, kasi mukhang marami yung mga may breast cancer sa family, ang payo ko is very maaga siguro ang screening. And we're talking about self-breast examination, mammogram, breast ultrasound, if possible, as early as 40 years old. Tapos nun, watch out for those maliliit na bukol na nakakapa. mas mataas ng kaunti ang risk mo, Desiree, kaysa yung general population kasi nga may family history ka. Pero hindi kasing taas kung ang family history mo ay direct. Like yun nga, nanay or daughter. Yun ang first degree relative. At saka, kung ang breast cancer sa family mo is in somebody who is younger than 40 years old, medyo mataas ang risk mo. Okay. Dex, back to you.
Perfect. So, very clear yun, Ma'am Desiree, no? It looks like mas maganda kung aagapan natin, conduct breast self-examination, and then of course, no, get your screening tests done. No? Ang dami nating institutions na pwedeng kang pagkaroon ng mammogram, ng breast ultrasound, just so that we can be sure kasi medyo mas mataas daw yung risk mo compared to the rest of the population. So, anything to add to that, Doc Via?
I can actually clearly relate to Ma'am Desiree, no? And especially dun sa concern niya, no? Apart from, having some patients that I encountered that had breast cancer before when we used to rotate in the hospital, no? I have a history of breast cancer in my family also, no? So one from the father side and mother side, no? Although they are sisters of both my mom and my dad, no? One of them actually has survived cancer, no? And she has been cancer-free for almost 20 years, no?
Yes.
So really, no, yung sinabi ni Doc Titit talaga regarding early detection is actually key for us to survive, no? And to really beat breast cancer. Yung pagkakapapo natin later on, baka pwede nating i-discuss, Doc Dex, no? Yung self examination, no? Kung kailan natin gagawin, especially sa mga kabataan natin ngayon, yung mga young women natin ngayon, kasi pabata na po ng pabata yung age ng nagkaka-cancer, no? Meron po akong na-encounter, no, na 20 years old, no, she already has she was diagnosed with breast cancer. So, the earlier po siya madidetect, the better po yung survival natin. So, important po, isa-stress ko po ulit yung sinabi ni Doc Titit, no, na early detection through self-breast examination is key, no, for us to be able to catch cancer in its early stage, no. Yung cancer po, it's a beatable disease, no. You can survive cancer for how many years, and I can attest to that, no. So, yung mga patients po natin that has breast cancer po, there is always help that is available, and cancer can be beaten po talaga.
Yan, thank you for that, Doc V, no? Cancer, talunin yan. So, then tayo sa ating next question is coming from Ma'am Vivian Felizardo. So, sabi niya dito, gandang gabi po mga Doc, itatanong ko lang po kung pwede akong magka-breast cancer dahil sa pag-inom ng pills. May nabasa po kasi ako dati pero matagal na. So it looks like may mga nabasa siya probably on Facebook, Viber, yung mga chain messages sa Messenger tungkol sa possible risk. So, Doc, nako, it has something to do with hormones. Possibly because either gamit na pills for population management or family planning, or possible din for regulation of her PCOS concerns. So, Doc, any response po tayo kay Ma'am Vivian? Very concerned po siya sa risk niya.
Vivian, I'm really happy that you asked about pills, because we are getting a lot of patients who are taking pills right and left without any advice from doctors. Okay, yung first generation pills po, yung pinakauna, kaya sabi po ninyo matagal na, right? Yung pong unang-unang pills, these ones, matataas po ang mga hormones nila, mataas ang estrogen levels. Sila po yung related sa breast cancer. Yung pong mga bagong pills natin ngayon, yung very low dose ng steroids, ito po, hindi na po masyadong related sa breast cancer. Pero ma'am, kung high risk po kayo, better na huwag kayo mag-take. OCPs are related to cervical cancer, but not so much anymore for breast, at least not with the newer types of pills that we have. Was my audio clear?
All right. Oo. Doc, si Doc Dex, I think, was having some sort of a problem, no? But yes, Doc, that was crystal
I was
clear,
here.
no? Yes,
Okay.
no, na
Sorry, I
yung
thought
newer
I
ones are
was
not as associated, no, especially if you're low risk naman, no. I-add ko lang, Doc, no, yung na I also have, no, ang dami ko kasing comorbidities, no, tsaka risk factor, kaya siguro probably I also was oriented to really get into the medical sciences, or at least, no, become a doctor, no. Because I also have polycystic ovarian
Oh
syndrome,
my
no?
gosh.
So,
Right.
so ano siya, no? I wasn't actually prescribed with OCPs by my OB before, no, because I was diagnosed when I was 17 years old, no. So because alam niya na I have history of cancer on both sides. So ingat po talaga tayo, especially dun sa history natin, no? And we always need to be able to detect it early, no? Kasi, especially dun sa may mga history talaga in the family, no? Kailangan po nating sabihin yun sa ating mga doktor, no? Especially since magkadugtong-dugtong po yan lahat, no? Yung family history, no? Anong nainom natin before, no? Kasi there are risks that are involved. Although, yun may mga bago ng, gaya ng sinabi ni Doc Titit, may mga bagong OCPs that are mas mababa yung ano nila, yung association nila with breast cancer. It's always important for us to be able to, see kung ano yung kung ano yung meron tayo, no, especially in our family history. No? Important po yun, no. Very challenging, Doc, akong case, no. Pwede akong maging case actually.
Ang maganda po dito is that na-encourage yung ating viewers na huwag matakot gumamit ng family planning methods. Lalong-lalo na the newer ones are less likely linked to breast cancer, no? And at the same time, tamang-tama yung sinabi ni Doc kanina na do not just take OCPs without consulting a health professional kasi mas nakataas po yung risk natin na magkaroon ng mga unintended effects at pag hindi naintindihan kung ano yung gagawin ng mga gamot na yon sa katawan natin. So very important to not just buy from the counter but get proper medical education and health education from our health professionals. Kaya nandito po tayo. That's why we're having this program. And of course, our services sa Alaga Health. So, talan tayo sa next question. And ito, natutuwa ako dito kasi this one is coming from a guy. And ito yung tanong niya, no? From Sir Paul Alfred Tan. So sabi niya, hello Alaga Health. Yung wife ko po kasi may history sa pamilya ng breast cancer. Gaano po ba kadalas dapat magpa-check at ano po yung mismong ipapagawa? Mahal po ba? Salamat po. Kinikilig ako dito kasi yung guy, yung husband is the one that's actively asking at concerned siya dun sa kanyang wife. So saludo kami sa inyo, Sir Paul. Sana po lahat ganyan, no? So, sige, let's give the floor to Doc Titit. Inikilig pa rin ako. Tuwa ako dito sa question. May guy na nagpadala na question. So, yes, Doc Titit.
I'm so happy yung husband ang nagtanong. Okay. So, first of all, ang first step talaga is to teach everyone self-breast examination. Dex, ngayon na natin i-discuss, pwede? Kasi kanina pa namin sinasabi ni Via. Alright. So, lahat ng babae ng reproductive age group, so from teenagers up to menopause, dapat marunong kumapa sa suso. Okay? So, ganito. The usual advice is do it pag natapos na yung mens. The week after the mens, what I teach my patients is under the shower, habang sinasabon mo ang katawan mo, you raise one hand, okay, like this. And then, kakapain yung suso around like this. Okay, so circular motion, sa labas muna, tas papasok papunta sa nipple. Okay, and then do it on the other side. So convenient, diba? Kasi nag-shower ka na rin lang at na yun yung sinasabon mo ng katawan mo, then that will be the proper way. So again, the week after menstruation, so wag isasabay sa regla kasi maraming nakakapa during menses. And do it while you're doing your shower. So, that's the first step. Self-breast examination kasi yung mga maliliit na bukol nakakapa daw by self-breast examination. And studies have shown that self-breast examination, dito unang nadidetect ang breast cancer. Next, since my family history yung wife ni, what's that called? Then I would suggest an annual checkup with a gynecologist. So, anong ginagawa ng gyne? So, kasama ang clinical breast examination. Ito na yung doctor ang kakapa. Okay? So, doctor ang kakapa ng suso. Tapos, of course, sabay na yung screening for cervical cancer, yung pap smear, pelvic exam. So, once a year na gyne exam. Then, if she's already of age, around 40 years old, pwede nang magpa-mammogram and breast ultrasound. So those are the two screening tools for breast cancer. So, Dex?
Alright, no? Ang ganda ng pagkaka-explain ni Doc ng self-breast examination, no? And Doc Dex, no, as someone, no, from the male population, no, sa mga magigiting nating lalaki, no, that's actually very important, no, for them to know also, no, na nakakatuwa rin yung question na hindi lamang po mga babae yung dapat makaalam nito, no? Especially those who have family members na may history ng breast cancer or kahit wala, no? It's important for them to be able to know how to conduct self-breast examination, or at least they're aware, no, para alam din nila kung paano ituturo, no, sa mga kapamilya nila, no. And of course, no, it's always better, no, to be able to have that information, no, especially if you have a wife, a sister who has breast cancer, no. Since my family or my risk, no, of breast cancer or developing breast cancer, if you have family history, no, especially dun sa mga first degree, no. So that's really important, no. That's a very, very good question, no? At least a doc explained it so well.
Kinikilig pa naman na lalaki yung nagtanong. Sobrang totoo na talagang responsible fatherhood, magiging responsible partner, kasi talagang siya yung proactive na nagtatanong dun sa para sa condition ng wife niya. So sana lahat ganon. So very excited for that. But before we jump into the next question, maybe it's time for a very quick Alaga Health update. There you have it. That was the newest ad of Alaga Health. And now I'll show you very quickly how easy it is to sign up for Alaga Health. So pakita ko yung screen ka ngayon very quickly. This is the Alaga Health website. So as you can see, meron siyang cute na animations, no? So meron siya yung mga rolling animations. Parang yun sa Apple website. So yan, the Philippines' first digital health marketplace and service hub. So you can even check the website, why we do this, the services that we offer, as well as the applications you can download, and even some of our advocacy partners here. But what I will be showing you is this one. So very quick lang, when you click the button there, top right corner, sign up, you'll be transferred to the registration page, no? So if you're a patient, especially to our viewers here this evening, shout out to our viewers tonight, no? And the family. Oh, Doc Joan is watching among all of our other viewers. Thank you for watching the program. And of course, if you're a health professional, no, you can pick the partner app. And of course, if you're a clinic manager, marami ka clinics na minamanage and you want to have a fully customizable accounting system as well as electronic health record system and even clinic manager, nako, you can check out the admin app. So for our viewers tonight, check natin yung patient app. So pupunta kayo dito sa data privacy page. Of course, read through that very quickly. Make sure this is checked and then just press continue. Then poof, profile details na tayo kaagad and just fill this up. Secure with the password, and then just press continue, and then voila, you are done. And ang maganda po sa ating mga Android users, no, you can already download the beta version of the Alaga Health app. Again, this is for the patients, no? And of course, meron tayong counterpart niyan for health professionals, our doctors, nurses. You can download this platform, and kasama na po dyan, will be coordinating with you, included na for free yung accounting manager as well as yung clinic manager for free, fully customizable. So you can easily transfer your practice to the platform. And maganda, we're the first digital health platform to be fully acknowledged by BIR to be compliant with tax guidelines. So kung kailangan mag-file na in the future or mag-coordinate ng lahat, very easy na. So with that being said, talan tayo, back to our questions. So we have here a question from Ma'am Charlene Santos. So sabi niya, hi, I just wanted to ask if you have OB-GYNs on Alaga Health platform already. Wow, thank you. We're hoping to book one since my husband and I are trying for a baby. Congrats po. And I think it'll be more difficult because I have PCOS and I was asked to take pills before. Okay, so very first question. Yes, we do have OB-GYNs, OB-GYNs on the platform already. And hopefully soon you'll also be able to book Doc Titit, no? Congratulations for trying for a baby. And yes, especially if you are dealing with a reproductive health and sexual health concern like PCOS, it's very good na ngayon pa lang you already consult with a health professional to better manage, no? And to ensure na medyo mas mataas yung likelihood of having a kid. I remember before my mom and dad were trying to have a kid. That's me. So they had difficulty, so they had to consult with an OB. And lo and behold, because they consulted, nabigyan sila ng proper guidance plus medications, and then voila, there's me. So, hi world, ako po ay resulta ng maagang pagpapakonsulta sa OB-GYN. So, with that being said, hopefully you'll be able to check us out, Ma'am Charlene. So, sinagot ka na yung question. I think tatalon tayo sa next question, which is, unless may gustong idagdag si Doc Titit tungkol dun sa concern niya about PCOS. Parang never tayo nagkaroon ng show nung walang nagtanong tungkol sa PCOS.
Yeah.
So,
Oo. Medyo,
concern is that sila kaya naman nag-pills kasi before. So, any quick response, Doc, to alleviate siguro some of the concerns ni Ma'am Charlene. Ayan na po, Ma'am Charlene. Ang sasagot na isang patikang OB-GYN. So exciting. So, Doc, any quick response po?
Ang PCOS ay isa sa pinaka, I guess, madaling cause na gamutin to have a baby. Because sabihin, ito yung isang concern na pwede naman, meron pong mga gamot na pwedeng ibigay. So I agree with Dex. Go ahead. Please consult an OB-GYN so the proper medications and the proper advice can be given to you. Ang daming may PCOS, no? Parating may tanong about PCOS in any of our shows. Okay.
Grabe.
Yes, Doc, no? Kahit na yung mga doctors na na nasa show, meron din PCOS. And I remember, no, add ko lang, no, palaging sinistress to nila Doc Titit sa amin before when we had our community rotations po. Kasi yes. I was fortunate enough and blessed enough to be one of the interns for the community enhanced program nung school namin before sa Ateneo, no? And Doc Titit before would usually advise us on what to tell the patients, no, especially when they want or they're desirous to have a baby, no. The importance, no, is not only doon sa pagbubuntis mismo, pero yung plano natin before tayo magbuntis. So it's very important for us to really consult at OB-GYN even before, no, nabuntis tayo, no, especially since may mga supplements na kailangan na nating inumin, no, if we want to be able to we want to be able to have a baby already, no? For example, folic acid, kailan natin iinumin? When do we start, no? And usually, the advice that they usually give a year before, if you want to have a baby, the next year you start now, no? And Doc Titit has actually stressed that, no? Na even before you get pregnant, you should already consult your OB, no? If you're desirous to have a baby. So, sa mga gusto po dyang maging mommies, no? Please consult your OB, no? Nandiyan po si Doc Titit. Isa po siya sa mga, one of the best OBs no, in the country. So, really, please consult your OB-GYN for concerns regarding sexual and reproductive health and of course, pregnancy.
Ako, hahanapan na si Doc Titit dun sa platform natin for sure. And ang masaya, again, I'd like to remind everyone po, no, that OB-GYNs, hindi lang po sila pupuntahan kapag kayo'y buntis. That's a big misconception, no? Pupunta lang sa OB kapag buntis na, no? They actually cover so many things regarding reproductive health and sexual health of women. So please, please, please consult with your health professionals. So, like right now, ay, wait, kinilig ulit ako kasi lalaki ulit yung nagtanong. This one, although hindi ayaw yung pasabi yung last name niya kasi I think for confidentiality reasons and then baka siya shy siya na malaman ng wife na nagtatanong siya for her. So ang tanong dito ay from Sir Justin R. Magandang gabi po. Tinuruan po kami dati sa center kung paano mag-check kung may bukol sa suso. Medyo kinakabahan lang po ako kasi tuwing meron siyang period, may nakakapa kami tapos nawawala naman. Ano po kaya yun? Ay nako, nabanggit na ni Doc Titit kanina, no? Particularly kapag meron kang periods, not really recommended na dun ka magbe-breast self-examination. Pero to explain more, ano ba daw, Doc, yung nakakapan nila? Kasi kinakabahan sila. Part pa ba ito nung time na merong period o iba na ba to? So, sabi naman niya nawawala pero pabalik-balik daw. So, Doc, anong response natin kay Sir Justin R? Saludo ulit kami sa iyo, sir.
I'm really happy na yung husband ang nagtanong. Siguro tumutulong siya mag-breast exam. So, happy rin ako doon. Pwede yun. Okay, go. I would like to emphasize, one, yung breast examination should not be done during mens. Okay? So, habang may regla, habang may period, huwag po ninyong gagawin ng self-breast examination or clinical breast exam. Kasi po, may mga bukol-bukol po na maliliit na nakakapa sa suso. So, ang tawag po natin doon, fibrocystic change. Ito po ay nawawala kapag natapos na po ang regla. So, siguraduhin lang po na the week after ng regla, pag nawala po, then maybe you are fine. And then, yun nga, sa susunod na buwan, huwag nyo na pong isabay sa period. So, I'm thinking probably it's a benign condition, probably fibrocystic change. Just to be sure, please repeat the breast exam pagkatapos ng regla, the week after ng regla, and make sure na wala na talagang nakakapa. That's it, Dex.
Yon. So anything to add to that, Doc Via? Particularly in terms of prevention, na idadagdag natin sa kanila. Anything else that you want to add?
I think yung in-emphasize ni Doc Titit regarding self-breast examination is still important, and yung timing po kung kailan natin siya gagawin is also important kasi baka minsan may mga kapa tayo na it's still related to the changes that we have, especially kung meron pa tayong buwan ng dalaw, no? And yes, Doc Dex, I learned that from you, no? Buwan ng dalaw. And of course, no, for prevention, most especially, no, you really for us to be able to detect if we're talking about breast cancer or any type of lesions dun sa breast natin, no? Especially since yung mga bukol na nakikita natin or na nakakapa natin may not necessarily be breast cancer all the time, no? That's why it's important for us to be able to do that, no? So, especially since, no, ang dami nang cases of breast cancer in the young women, no? So that one I think should be in the norm na part na yun ng routine natin, especially kung sa mga babae po, no, if we are having our or if we just finished our period, no, part po yun ng cycle natin to be able to do self-breast examination.
Perfect. Thank you for that, Doc V. And then, yes, Doc.
Next, may I add, another time pala that you're not supposed to do breast exam is pag nagpapasuso ka. Kasi merong makakapa yung mga ductules ng gatas. O kaya yung mga
Puno,
ducts
yeah.
ng gatas. Oo, puno yun. So, baka yun ang makapa mo and then you're scared na baka siya breast cancer. So, not while breastfeeding also.
Alright. So again, reminder, 2 periods, especially yung wag magbe-breast self-examination, no? Kapag ikaw ay mayroong period, and at the same time, if you are breastfeeding. Yan. So, very good to remember those. But now we go to our next question. This one is from Ma'am Cristina Mendoza. Ito, interesting to. Totoo po ba na may gamot o bakuna para sa breast cancer? May edad na po kasi yung nanay ko, kaya natatakot po kaming magkakapatid. Yung tita po kasi namin nagka-breast cancer dati. Okay, medyo my heart is warm na they're looking out for their mom. So thank you, Ma'am Christina, for looking out for your mom. Kasi again, breast cancer typically would manifest for the older generation, no? Pero let's give the floor to Doc Titit to better explain siguro. Meron na ba daw ba, Doc, na gamot or bakuna? Kasi for example, they may have heard the vaccines, yung mga HPV that they have, no? So any developments on the breast cancer side, Doc?
For now, wala pa ako nababalitaan na vaccine for breast cancer. So, yung talaga, yung pagkapa lang talaga ng suso ang naiituro natin for now, for early detection. Yun pa lang, Dex. Wala pa ako nababalitaan talaga na vaccine for it. Yeah. Via, ikaw?
For us also, Doc, no, wala pa rin, I don't think, wala pa rin, at least for now, no, na known vaccine talaga. Parang wala, I'm not sure if there's something in development, pero for now, no, yung pinaka-preventive talaga would be the, the self-breast examination, which is yung, the pillar, one of the pillars of prevention talaga, no. Tapos, yung gamot, no? There might be, baka may naririnig sila na may pill, no, na iniinom ng mga breast cancer patients. It's probably the tamoxifen, no? Yung the oral chemotherapy, no? And that's the drug na tinitake po ng mga breast cancer patients, no? Oral chemotherapy, no? And that's not necessarily for preventive, no, because that's oral chemotherapy. It's not.
Yeah.
Gamot na po siya.
Para sa may cancer na. Yeah.
Para sa may cancer na yun. That's really for yung preventive talaga is for self-breast examination.
Perfect. Thank you for that, Doc Via, no? And for now, as we near the last quarter of our program, it's time for a very quick detour for Alagang Hello Doctor. So today, we will be showing you an article from one of our partners, no, hellodoctor.com.ph. And again, they are the Philippine hub of the Hello Health Group, which is present in over 9 countries. And we're very lucky and thankful that of all of the health firms in the Philippines, they chose to team up with Alaga Health, no? And we're very excited about that. So today, this one is about the causes of breast cancer, and this one was written by Maybelline Cabigao. And ang maganda po sa hellodoctor.com.ph, they are medically reviewing all of the content. So sila kasi sigurado po tayo na the content that you're viewing is medically checked and verified. So for example, we have health professionals watching the program and you want to be a writer for Hello Doctor, and even content verifier, nako, better reach out to them or probably even through us, and we'll be happy to link you to them. So ang maganda dito sa article na to, they will tell you what breast cancer is, no? And may maganda, may mga infographics pa sila, and they'll try to show you all how to do breast self-examination, no? And even the causes, as well as issues regarding genetics, as well as ito, magandang list, risks for breast cancer. A lot of this nabanggit kanina during our discussion, no? You can actually read this during your leisure time, how to possibly lower your risk. Maganda dyan, nakikita ka dito, breast awareness. Yan. So what happens, and some key takeaways. So maganda po sa Hello Doctor, you can even check out their main page and check out all of the other articles that they have regarding so many other diseases. So yeah, with that being said, that is Alagang Hello, doctor. And now back to our program. So we have a question that came here. No? This one is from Ma'am Sam Guevara. Kapag paiba-iba po ba yung period, mas mataas na yung chance magka-breast cancer. Minsan sobrang lakas, minsan sobrang hina, tapos iba-iba din yung tagal. Salamat. Nako, sounds like abnormal urine bleeding. Pero let's give the floor to Doc Titit, no? Kasi parang lahat ata ng permutations, Doc, ng abnormal uterine bleeding, parang chinek ni Ma'am Sam. So, ano pong masasabi natin sa kanya, Doc?
Okay, so based on the question, yung period niya, iba-iba yung timing, right? Kuminsan mahina, kuminsan sobrang lakas, minsan naman sobrang hina. So, this is not related to breast cancer. This is more of abnormal uterine bleeding. Siguro dapat unang-una hanapin yung dahilan kung bakit ang regla mo irregular. Tapos nun kung bakit mahina, kung bakit malakas. For ang AUB, abnormal uterine bleeding, per se, walang relation sa breast cancer, pero kung yan ay estrogen-related, ibig sabihin, kung mataas ang estrogen mo, so based on the tests, nakita na mataas ang estrogen levels mo, then it becomes related to breast cancer. Kasi ang breast cancer, related yan sa pagtaas ng estrogen. So I think the first step, Sam, in your case, is find out about the abnormal uterine bleeding, kung ano yung dahilan, and then kung merong possible risk factor na related sa breast cancer, yun na nga, ang nasabi ko na nga is yung estrogen.
Yeah. Perfect. And to add to that, Doc Via, no, kasi ito, common question to ng patients, not necessarily even just talking to OB-GYNs, but in general, no, a common question yung abnormal uterine bleeding. So any quick response kay Ma'am Sam?
I'll just like to add dun sa sinabi ni Doc Titit, no, kasi this is very substantial, no. Usually, no, mas related yung breast, if you notice, no, yung palaging sinasabi, no, na yung breast cancer, ang usual patients nun would be yung mga matatandang dalaga, yung mga walang asawa, no, because that's related to breast cancer is related to exposure, no, to estrogen, no, and because, you know, for those who are married, those who get pregnant, no, they get the estrogen pause, no, because of the pregnancy, no. That can be protective, but that doesn't mean na pag nag-asawa ka at nag-anak ka, wala nang chance na magka-breast cancer ka, no? What we're talking about here is just risk, no, yung the possibility, no. But there are still other factors that we need to consider, no, especially since we're talking about a disease that can easily develop and spread if not detected early. So there is wala siyang kumbaga direct na correlation or association, pero important na hanapin natin kung anong pinanggalingan, no, ng pagkakaiba-iba ng period, kasi having irregular periods are what we call, no, and pinamemorize namin to ni Doc Titit before, no, abnormal uterine AUB, abnormal uterine bleeding, and it has a lot of causes, no. Marami yan, may polyps, no, may adenomyosis. So, kung i-explain ko yan, no, medyo pound coin.
Pound coin.
Pound coin, yes.
Valida sa OB, no? Leiomyoma, malignancy, no?
Yeah.
And everything. Mahaba po yan, no? If ever po, we can discuss, no, abnormal uterine bleeding, no? Kasi related din po yan sa
isang topic, sobrang daming pwede.
Isang
episode yun.
Even more, no?
True. And I think it's a very common thing.
We have to investigate, no? Kahit na hindi siya related to breast cancer, investigate natin kung saan nanggagaling yung abnormal uterine bleeding ni ma'am.
Perfect. And I think the next question is a really good way to wrap things up. And kinikilig ulit ako kasi Guy, ulit yung nagtatanong. This is from Sir Fred. Kapapasok lang. Sir Fred Di Mapilis. Sabi niya dito, ano po bang gamot sa breast cancer? Na-diagnose po kasi yung nanay ko, pero hindi na po nag-follow up kasi takot kami sa COVID. So mukhang na-diagnose si ma'am, tapos ayaw nila o natatakot silang bumalik sa hospital. Hindi nila alam yung gagawin nilang next step or ano ba talaga yung gamot sa breast cancer. So naku, maraming layers po ito. Depende sa ano na po yung stage no nung cancer na diagnosed po sa mother ninyo. Pero I think I'll give the floor to Doc Titit regarding typical treatment options na pwede natin i-expect to those na newly diagnosed with breast cancer. Kasi I think familiar scenario to. I actually have a cousin-in-law na had breast cancer. And then, as part of the treatment modality na mastectomy. So, of course, part of the monitoring, one of the concerns is bumabalik siya. So, one modality would be that one. But of course, there are many other treatment options. Nabanggit ni Doc Villa kanina yung tamoxifen. So, I'll give the floor to Doc Titi.
So, I'm assuming, Fred, that the cancer of your mom, tama, no, mommy? Yeah, nanay niya. Na-diagnose through a biopsy, kaya sinabi talaga na cancer. Kasi that's the only way you diagnose with a histopath diagnosis. So yes, number one, it depends on the size, the stage, kung ano po yung gagawin. Usually, alright? So hindi ko po alam yung background ng nanay niyo, Sir Fred. Pero usually po, tinatanggal po ang suso. So yung operation po ay tinatawag na mastectomy. Tapos depende po sa stage. Yung post-op, pagkatapos po ng operation, kadalasan may radiation at may chemotherapy. Now, I understand kung ano po yung nararamdaman nyo, na takot po kayong pumunta sa hospital dahil sa COVID. Kaya lang po, ang breast cancer, kuminsan po, madali pong kumalat, at mabilis pong tumaas ang stage. So baka naman po pwedeng humanap po kayo ng isang clinic na relatively medyo safe po. Siguro kaya ng teleconsult muna. And then later on, consultation with your doctor. Kasi po, I think kailangan pong ma-manage ito sa lalong madaling panahon. Okay, so basically, ganun po. May radiotherapy, may chemotherapy afterwards. Tapos may mga follow-up tests po pagkatapos po nung mga sinabi ko po yun. Okay.
Alright.
Next.
Thank you very much for that, Doc Titit. No, anything to add, Doc Via?
No, I think since we don't know pa yung case ng mom ni Sir Fred, I think what we need to add here is more than just yung na-explain ni Doc Titit, that's actually how we would usually approach yung breast cancer. And it will also depend if ever there's already metastasis, kung nag-spread na po ba yung cancer, that would also matter kung paano po natin i-manage yun. So for me, it's best for your mom, Sir Fred, to be seen by a doctor, ASAP. Because yung hinahabol natin dito, we don't want the cancer to spread, actually. And depende po yun talaga, yung treatment natin, whether tatanggalin po ba natin or magki-chemotherapy po ba muna tayo. That would really depend on sinabi ni Doc Titit sa size, sa stage, and if may kumalat na po ba na cancer dun sa natin, sa katawan ng mom niyo po, Sir Fred. So it's important, we would highly advise you to seek consult immediately, especially since hinahabol natin yung na hindi lumala yung cancer ng mom.
Perfect. So with that being said, thank you po to everyone who's watching the program. Shout out to the Sano Noy Diana family, Rafael family, of course, and all of those who are watching. And with that being said, it's time for our wrap up. So we've come to the last part of the program, and as always, now we will give our guests as well as my co-host time to give their final words about breast cancer awareness and plug anything that might be coming up, particularly in their medical societies or their institutions, para mas lalo po nating mapalaganap yung advocacy building natin at marami pa tayong information na ma-share, especially if you have upcoming events or meron tayong mga programs or campaigns na gusto i-push. So I will of course begin with Doc Via. Anything to say as your final words or probably anything to promote?
All right. So thank you again, Alaga Health, for having this topic. No, this is something na pinush talaga no ng team, no, because it has been there have been a lot of initiatives for breast cancer, pero hindi pa rin po tapos ang laban against breast cancer. No, so again, no, early detection is key palagi sa breast cancer, no? So wag po nating kalimutan yung tinuro ni Doc Titip, no, for self-breast examination and kailan siya po gagawin and kailan po natin siya hindi gagawin at gagawin, no? Please take note of that, no? And always po, please take care of yourself and your health. It's a way for us to be able to practice, no, self-love and of course showing others and showing our community how we can take care of them also. So muli maraming salamat po, Alaga Health, and of course to all of our viewers who have been watching us every week, no. Patuloy po na yung pag-iigihin ng ang aming programa, no. And Doc Dex, no, we will have a new time slot. No, this is actually a season end. No, we will have a new time slot for Alaga Health, no? So Doc Dex will be explaining that, no?
Sure.
No?
Great.
So we were very lucky actually and very privileged to have Doc Titit as one of our season enders, and of course you'll see more of her, no, in our next seasons, no. And marami pa kaming there will be a lot of activities, no, may mga gimmicks ang Alaga Health team, no, dun sa next season natin, so abangan niyo po yan. Thank you so much po, and magkita-kita po tayo ulit next week for another Alaga Health Live.
Perfect. And now, of course, let's give the floor to the one and only Doc Titit Villanueva.
First of all, thank you very much for keep on inviting me. Siguro sana hindi kayo magsawa. To the ones who ask questions, I would like to say I really empathize with you. Kasi Via, hindi lang ikaw. I lost my sister this year to breast cancer. So medyo devastating yung loss na yon. And to our viewers who are asking about relatives who have it, I know what you feel. I know your concern. I know your worries. So once again, it cannot be overemphasized that early detection is important. So self-breast examination, clinical breast examination by your doctor. So please see your gynecologist for that breast exam. Kasi baka hindi nyo makapa niya. Number 3, mammogram and breast ultrasound. Yung mga hindi na itanong. Totoo bang masakit ang mammogram? I have had several mammograms. So magkakaiba po yung experience. Hanapin nyo na lang po yung ospital na hindi masyadong masakit. Kasi sa totoo lang po, may mga hospital sa pag inipit po ang suso ninyo, medyo mapapasigaw kayo ng kaunti. Pero yung last mammogram ko was fine. May tinatawag pong kung kaya nyo hanapin, digital mammogram, hindi po masakit ang mammogram na yon. Coupled with a breast ultrasound. So these tests, ito po yung primary, yung pong self-breast examination hanggang mammogram and breast ultrasound, hopefully will lessen the burden of the disease. Sana po ma-detect ng maaga. So far, hindi pa po natin kayang i-prevent ang breast cancer. Sad to say. Pero pwede po siyang magamot. Okay? Pag maaga po siyang nakuha at maaga po siyang nagamot, pwede po siyang gamutin. I have one tita, 30 years na po na survivor. So ganun po, medyo magkaiba po yung experience. Okay, so thank you very much for your questions. Thank you very much for your trust. And congratulations, Alaga Health, for a wonderful program. Dex and Via. I congratulate
Thank you very much. Thank you very much, Dr. It's a pleasure to have you in the program. And again, thank you to all of our viewers who continue to watch this program. And again, this as mentioned by Doc Via, this is actually a sort of a season ender because we'll be moving to a time slot wherein we think a lot of people will be even more engaged to ask their questions. At ako, konsultahan tayo tuwing tanghali. We're moving to a time slot every Monday, 12 noon. So while you're probably having your Monday lunchtime meal, no, we will be going live and I'll be answering all of your questions. And hopefully you'll be joining us again. And don't worry, no, sa mga gusto pa din magkaroon ng mga Saturday events, we'll still be having some in the future and just stay tuned regarding that. And of course, since we're moving to a new time slot, kailangan maganda yung ating buwan naman ng topic. And since this week, we talked about our moms or our ladies who are probably concerned about breast cancer. Whereas even not just the women, no, but even the men. Tuwang-tuwa pa rin ako na maraming guys na nagtanong, husbands, no, that are asking about the welfare of their wives. Nako, from them, pupunta naman tayo sa mga kidilets as we enter National Children's Month. Nako, so that will be our very first one to our new time slot. And of course, stay tuned and watch. Every Friday pa din po tayo. Happy Hour for Mental Health with Doc Joan Refrial. She was watching also just a while ago. And of course, join us in the next episode of Checkup focusing on the kids. So once again, I'm Doc Dexter Galban, reminding everyone na alagaan ang inyong kalusugan para masumunlad ang ating bayan. Thanks everyone. Have a great evening.